Leanne. Well, thank you everyone for taking the time to attend these presentations this afternoon. In many respects, it's quite appropriate that mine is first up because I'm dealing with the assessment of problem dry mares and what we need to know before we cover them. 10 to 15 minutes, which is how long this presentation will be, in many respects is nowhere near enough time to cover what can be quite a complicated and involved topic. Many of you have probably been involved in dealing with problem dry mares in the past, so you will understand this. I do very much focus in my presentations on visual aids more than a lot of writing. So I hope that's a bit more entertaining than screens of writing and me drolling on too much. So without further ado, I shall kick on. First thing to say, and I usually begin all my presentations with a mention of the fact that the mare is one of three main areas that we deal with in equine reproduction. The other two obviously being the stallion and the way in which the breeding is managed. Whenever we think of problem dry mares, we must always keep in the back of our mind these other two factors. The way that the mare is managed, obviously we have a lot of input in as managers and veterinarians. The stallions, probably not so much input, but today we'll be focusing on the mare, which is where we often direct much of our effort. So the first question that's probably worth addressing is, what is a problem dry mare? And a problem dry mare means different things to different people. Is it a mare that hasn't been in foal for many years? Is it a mare who hasn't been in foal subsequent to breeding over 2 or 3 cycles? Is the problem that she's not going in foal, that is she not detectably in foal? Or is the problem that she can conceive, she can be diagnosed in foal, but then she doesn't stay in foal? Again, it means different things to different people. My brief assessment would be perhaps a mare who, after 3 cycles of good breeding management and being bred to a stallion of known good fertility, is still not detectably in foal. I would classify her as a problem mare, and I'd probably investigate the cause of that problem further. The other question, which I think is quite relevant, is when should we assess a problem dry mare? What tends to happen, I find, is at the end of the breeding season, come December and Christmas time, a lot of us are quite fatigued and we're quite jaded by the breeding season, so we put them on the back burner, or the back paddock as the case may be. Sales season is upon us, our focus shifts, then it's winter, and then suddenly it's July and August and we're considering putting them under lights. And so once we figured out when we assess them, which I would say probably at the end of the season, before we forget about them, is the appropriate time. The other question we need to address is, how do we assess them? And that's what I'll be focusing on today. A few tools we have, a few things to consider, and the way that I approach a problem dry mare. So first, and in many respects, most importantly, is to look at the history of the mare. It's often overlooked, and yet it's so important. Again, you know, what one person considers a problem dry mare may not actually be a problem to another person. For those involved with thoroughbreds, the Australian Stud Book is a useful, but not necessarily perfect source of information. And certainly most of us at Crush side will have some form of breeding record, whether a file, piece of paper, digital records. And certainly over the years, I've seen varying quality and varying consistency of breeding records. But first and foremost, if I'm assessing a problem dry mare, I'll look at her breeding history. As part of a pre-breeding assessment, it's important to look at a mare's general health. So basic things such as body condition score, basic dentistry, worming programs, vaccination programs, are often easy to overlook, but are very important. One of the approaches I do like to take is I consider the anatomy of the reproductive tract, and I work my way methodically through the various areas that I have listed there. So an inspection of the external reproductive tract, that is the perineum, and then an assessment moving forward through the mare, moving towards the head, the vagina, the cervix, thinking of the uterus, the oviduct and ovaries. One of the areas where we have the most capability to conduct diagnostics is to assess the uterine environment. And I'll go through a few diagnostic techniques we have for that. Fairly common ones, which most of you should be familiar with: the use of ultrasound, the use of uterine culture and cytology, and also uterine biopsy. So again, an assessment of the external reproductive anatomy of the perineum. These are some fairly obvious things to assess. We have a grey mare there with fairly significant melanomas and a perirectal abscess about to break out, a mare with a vaginal discharge, a mare with EHV3, and also a mare, although you can't really appreciate it there, that actually has a 3rd-degree perineal laceration. So these are relatively important things to consider. We often think about, something simple like, does the mare need a Caslick or not, which obviously is important, but I think you still can glean quite a lot of information from a very basic visual assessment. Moving forward from the vulva, we can assess the vagina and certainly the external os of the cervix with a vaginal speculum exam, and there are different tools available for that. There are disposable tube type speculums, there are duct-billed speculums, and with that we can assess the integrity of the external os of the cervix. We have quite a nice image there of a lacerated cervix, which would obviously impact the mare's fertility. Commonly too, we see urine pooling or urovagina, where urine accumulates in the craniovaginal vault. And we can also utilize ultrasound to actually assess the vagina in many respects too. The bottom image there, even though it's from a post-foaling mare, you can see the accumulation of urine in the cranio-vagina, and also a dilated and somewhat paralyzed urethra. Moving forward from the cervix is the uterus, the oviduct, and the ovaries. So thinking about these structures is one way I methodically work through a problem dry mare, and things I think about when I assess them. And these are fairly extreme examples here. On the left, there's actually a mare who has a condition called uterus unicornis. That is, only one uterine tube is fully developed. So obviously that mare, if she ovulated off the ovary on the left, she wouldn't conceive. In the top right, we have an image of a suspected blocked oviduct. The arrows indicate areas of dilatation and scarring. And also, as well as considering the uterus and the oviduct, then we move forward to the ovary. And again, bottom right there, we have a fairly dramatic image of a granulosa cell tumor on a mare's ovary. But again, it's more, I want to highlight here the methodical approach of moving forward through the reproductive tract, considering each anatomical structure and the problems that can arise in each of them. So ultrasonography, obviously an incredibly important tool in equine breeding management these days, and it certainly is important when we assess a problem dry mare. Again, these are fairly standard images we have here. We can assess ovarian structure. The image in the middle is of a normal CL, so we can assess if a mare is cycling, producing a CL of appropriate size. We can also assess the follicular development and ovulation. and likewise, we can use ultrasonography to assess the uterus for fluid, appropriate edema, cysts, foreign objects. The uterine swabs, again, many of you will be familiar with the taking and interpreting of uterine swabs. In many areas, it's a compulsory requirement prior to sending your mare to the stallion. And on the left there, we have a fairly standard image of a double-guarded swab to help minimize or prevent contamination and false positive or false negative results. It's also an image of a cytobrush there, which we don't tend to use routinely, but they've been available for quite some time, and they do provide a very nice cytology sample. So the two things we look at when we take a uterine swab, we look at the cells that we procure from the sample. And in the middle there, we have an image of some white blood cells indicative of an infection in the uterus. And then obviously as well, we have the culture plate on the right growing looks like some beta hemolytic strep there. It's important when we interpret the uterine swabs to not interpret the culture result in isolation from the cytology. Many people feel that the cytology is more important or diagnostic than the culture result itself. But again, assessing a problem dry mare uterine swab is fairly integral to that. Following on from uterine swabs, we can perform a uterine lavage on the uterus, and we can use that fluid to make some judgments about the condition of the uterus, and that's often what we do if we suspect there is a problem in the uterus, but we're failing to pick up any problems on the uterine swab. So the next step would be a uterine lavage, culture and cytology. And again, I've got some fairly nice examples here of looking at what you get back from the uterine lavage fluid to make some judgments on the condition of the uterus. Now, again, these are fairly extreme examples here. Many of you would have seen some of these. The yellow one obviously is from urine in the uterus. We have a mummified or macerated fetus on the right. We have a mare post-endometrial cyst ablation on the left. And then the two syringes there are just basically pus that we recovered from a uterus. So the quality of the uterine lavage fluid obviously does also tell us a lot about the condition of the uterus, and is a very useful tool when we assess the problem dry mares. So just again, just with this 10 or 15 minute talk here, I'm touching on the fairly basic things here, which many of you would have come across. So I'll talk briefly about a uterine, or more correctly, an endometrial biopsy. A biopsy really is, in many respects, a gold standard for assessing the condition of the uterus. And from that, we look at two main things. We look at the evidence, or look for evidence of inflammation or infection. And we also look for indications or the severity of any fibrosis that is occurring in the uterus. And from those, we develop a score, and we have various grading systems that we use for that. And based on that, we can prognosticate to a certain extent on the likelihood of a mare both conceiving and maintaining a foal to term. We tend to do this towards the end of, or the beginning of, a season, or once a mare has come back empty several times. I wouldn't necessarily say it's an invasive procedure, but it's not one we do too commonly, but it is a very useful diagnostic aid. We do have a number of different stains we can use for this as well, which we can use to highlight various changes to blood vessels and to different layers or levels of the uterus. And my final slide, and the final thing that I'll discuss here, as I'm probably running out of time here, is the use of hysteroscopy or uterine endoscopy. And that is sticking an endoscope in the uterus. And this has been available to us for quite some time. We're doing it more and more, and the more we do it, I think the better we get at interpreting our findings. I have three images on the screen there. The one on the right, again, is urine in a uterus. That's an older image, so the quality is a little poorer, but you can, I think, still see quite clearly the effect that urine is having on the lining of that uterus. It's quite scarred and mottled and doesn't look very healthy. The image on the left is from a endometrial cyst or uterine cyst removal procedure, where we snare them and use electrocautery to remove cysts. And then in the middle, quite a nice image, I think. It's actually a mare who's had a C-section previously, and quite incidentally, we actually discovered that scar when we passed a scope into her uterus to assess the condition of her uterus. So yes, we do that more. It is a useful diagnostic tool, but one of many that we use to assess problem dry mares. And yes, we are doing it more frequently these days. So with that, I will finish up, and I will wait to see if there are any questions. So I do, Julianne, I do see one question there.
There it is.
And the question is, what is the best way to get rid of fluid? I'm assuming that question, Bart, is from referring to uterine fluid. So there are a number of ways to get rid of it. And again, I would preface my question by saying it really depends on the quantity and the quality of that fluid. And by that, I mean, again, is it urine? Is it blood? Is it pus? Is it mucus? So depending on both the quantity and quality of that fluid, look, the basic ones would be uterine lavage, obviously. We do tend to flush until the fluid returns clear. Most of the time, if I'm using more than 2 or 3 bags, I'm probably going to scratch my head a little bit. Other useful adjuncts to get rid of uterine fluid, oxytocin, a great ecbolic agent. It's cheap, it's easy to administer. It's a natural hormone, so it mimics the mare's natural uterine clearance hormone. Some people also employ prostaglandin in smaller doses, and that tends to have a longer duration of effect. The half-life of oxytocin is very short, at 8 minutes. So you do have to give small volumes quite frequently, but the addition of prostaglandin, you can stretch out the interval between the administration of prostaglandin injections. So, sorry, a bit of a vague general answer. There's one other question here too. What procedures are there to correct or improve urine pooling? That's a very good question. There are a number of procedures available. There are many reasons why a mare might pool urine. I find that post-foaling mares often do it because obviously they've just been through the trauma of foaling, so there is often a bit of paralysis and flaccidity in the caudal reproductive tract. So those mares I'm a bit more lenient on, and I'm not too aggressive with them. If it's a mare who has a chronic urine pooling problem, there are procedures. There are certainly urethral extension procedures, which are done reasonably commonly now and have been around for some time. They are generally very good, and most surgeons that are doing them, and I know Amy Williamson, she's talking later here about angular limb deformities. I know she does a very good job with them. So that would be yes, as a surgical procedure, urethral extensions would probably be the most common one. At times, something as simple as a perineal body transection, which is also called a Perret procedure, that may be enough to correct very mild urine pooling. But look, in my opinion, if it's severe enough to be considered a problem or affecting the mare's fertility, I would go for something like the urethral extension procedure. Just another couple of quick questions there, Bart. Sorry, thanks for that. I just see there. Would you give your mares oxytocin routinely post-foaling to help clean? I'm going to be a little ambiguous here. I'm going to say yes and no. It really depends on the farm, the management, and the situation. For example, we have a mare who has just foaled towards the end of last week, and the foal has immature tarsal bones, so it's confined to a box. That mare is on routine post-foaling oxytocin because she's not moving around, so she needs a little bit of help, in inverted commas, to involute her uterus or to help remove any excess fluid in there. Yeah, so look, a lot of farms do it routinely. I probably wouldn't think it would be necessary on a routine basis. I would certainly take it on a case-by-case basis. And then I have another question here. It says, how would you treat a mare that is drug resistant? Oh, that's a really good question. That's $1 million question, that one. I would say, the first thing I would say is, what is the bacteria? I would also look at what antibiotics have you tested. We are moving away from I guess the large volume uterus, the large volume use of antibiotics in reproduction in general, and especially uterine antibiotics. So if the basic available antibiotics, if the bacteria is resistant, first of all, I'd probably look at a reason as to why. I'd ask myself why she has this infection. Is there a conformational trait that needs to be improved? Then we go to our non-antibiotic treatments, and we look, the list is quite long. Peroxide, acetylcysteine, Tris-EDTA. Some people use ozone, Milton's bleed. There's a long list of things. So I hope that kind of answers your question. It's not an easy question to answer per se. Yeah, the one thing I'd say is, be sure of the bacteria that you've grown. Is it a pure growth? Does the cytology match? Have you tested all of the available antibiotics that we would use? I mean, obviously there's some we don't. And then if that's a problem, look at your potential reasons why she's got that infection, address those issues. And then, yes, consider the use of the non-antibiotic therapies. Like I said, there's peroxide, Tris-EDTA. There's a whole lot of them. So